This project was part of the patient flow optimization project, and within that project, this was looking at the discharge planning portion in particular. As the physician lead was looking at how we could improve the communication between physicians and case managers and nurses, and with the implementation of the .DC needs smart phrase.
We started working on a discharge planning pilot. This was really intended to optimize the tools that we have available to us through our Epic EMR, and to also allow for a more synchronized workflow amongst various team members who are participating in providing care, really bringing a collaboration together between the medical team, the providers, the charge nurses, and then our RN care managers and social workers who are all participating in actively planning for a patient's discharge.
An improvement was needed because one obvious reason was the number of patients waiting in the ED for a room. In fact, we have capacity issues here, and so we needed to improve our discharge processes so we can make room for the patients who are still sick. And then also there was a lack of communication between providers, nurses, and case managers about what remained to get somebody out of the hospital.
Healthcare becomes so complex, and that there are many different clinical teams and groups coming together to provide care for a patient when they're hospitalized. If all the tools are being utilized and everybody's playing their part, it is nice to be able to see all of that information in one place so that you can understand what's physical therapy recommending, what's occupational therapy recommending, what is the doctor saying. And then my team, the care management team, is able to pull all that information together and create the best possible discharge plan. The end result for the patient, hopefully, is just that their hospitalization is as seamless and smooth as it can be, that we're able to get them out in an efficient and timely way.
So I think one of the favorite parts was actually working with all of the different disciplines involved, the nurses and case managers and the other proceduralists, to figure out how we could all work together to make a smoother communication method that would also reduce the number of interruptions in everybody's day, and also make it more clear about what was remaining for a patient to be discharged.
So I think one of the benefits that we've seen from this pilot and this work is that our ability to more accurately predict the number of patients that are going to be discharging on a daily basis is improved, and we still have work to do, but we are definitely seeing an increase in our ability to be able to have that predicted number be more accurate. So it gets better and better as we go, and ideally we'll be at one point where we can know for sure that within a certain range our predicted number of discharges is very, very accurate.